Hey, it's Professor Kristen, and today we're going to learn to identify a normal EKG. Our learning objectives are really geared towards the first-year nurse or nursing student. And your objectives will be to identify if this EKG has a P wave, has a QRS complex, has a T wave, and actually understand what the heart is doing physically when we see these waveforms on an EKG. Is this a normal EKG complex? Yes, we see a P wave, a QRS, and a T wave. For a normal EKG complex, there should always be three distinct waveforms: P, QRS, T. First, is there a P wave? As you can see on the EKG, you have a small kind of bump on the waveform, and that is a P wave. What happens to get that electrically is physically the atria will be full of blood. The SA node will fire, sending an electrical response throughout the atria, causing atrial depolarization. This is a P wave. What is a P wave? Like I said, it's a little small bump that you'll see on the EKG. It should always be before a QRS complex. It should be the first waveform that you identify. It's depolarization of the atria. That is the start of the contraction of our heart. Second, is there a QRS complex? That should be the waveform you're trying to identify next. You've seen the P wave, and following that should be the QRS complex. What is the QRS complex? It is the largest distinctly visible complex that you will see in an EKG. It happens after the atria fills the ventricles. It's representing ventricular depolarization. But let's break it down a little further. The QRS complex is the firing of the AV node, and it represents ventricular depolarization, like I said. The Q wave is action or depolarization of the interventricular septum. So you're going to see this whole thing is happening in a wave-like substance, a wave-like movement. And we're seeing this in the muscle contraction, but in an EKG, that's what we're seeing in this electrical tracing. The R wave represents depolarization of the mask of the ventricles, the mask part of the ventricle muscle. So you have the interventricular septum, Q, go up to the R. We're depolarizing the mass muscle of the ventricles. And then the S wave coming down is the last phase of depolarization of the base of the ventricle. Third, is there a T wave? You've seen a P wave, you've seen a QRS complex, and now you're looking to see if there's a T wave. And as you're looking at this EKG tracing on the PowerPoint, you see a T wave. See where it is highlighted in the darker teal section? It's normally the same direction as your QRS complex, and this represents repolarization. At this point, I'm going to take a minute to talk about depolarization and repolarization. This is the actual voltage from sodium ion channels that open, and we have a shift. So when we're depolarizing, the membrane potential goes into a positive state. That's our contraction. When we're repolarizing, we are now going back to a negative state, and the heart is going back the muscle to rest so that it can fill and we can start the pumping action again. The T wave is our most labile waveform, and its changes can be indicative of cardiac and non-cardiac disorders, which we will learn in the next chapter. Let's review. Is there a P wave? Yes, there's a P wave. Now, what comes after the P wave but a QRS complex? Should all be going upwards? facing, going towards the ceiling? And yes, there's a QRS complex. Is there a T wave? Yes, there is a T wave. So in the review, we have identified a normal EKG tracing with a P, QRS complex, and a T wave. Now you can identify a normal EKG. Here is a normal EKG tracing with a P, QRS complex, and a T wave throughout. One of the things that you need to note is if you come across something where you don't have a P wave, or you don't have a QRS complex or a T wave, or you have abnormal tracings, things that are not going upward or looking like what you've seen in this PowerPoint today, please let your instructor know, the nurse taking care of the patient, or the provider, because this needs to be identified and treated.